Hi, my name is Zarina and I work for Elite. Elite is a fantastic program here at London Stock Exchange Group that helps ambitious companies to scale up, structure for internal growth and further investment. And today we have Sarah here, who's the CEO of one of Elite companies, Arecor. So Sarah, if you could tell us a bit more about you and the company.
Sure, so my name's Sarah Howell, I'm the CEO of Arecor. About myself, very originally, I have a PhD in chemistry and I've spent all of my career to date working for various pharmaceutical development companies for the past 17 years. I started off in Big Pharma, GSK, and worked for UCB Celtec, BTG, a specialty pharma company, and joined Arecor in the back end of 2011. And ultimately took over as CEO 2 years ago. So in terms of Arecor, we're a spin-out originally from Unilever, founded back in 2007. And since that time, we've developed an innovative and proprietary formulation technology platform that we leverage to develop what we'd call superior biopharmaceutical products. We have a dual business model. We work both with pharmaceutical companies on their proprietary products, so products within their pipelines, where we use our technology to deliver superior product profiles for them and product formats, and we do that under a technology licensing model, and that business is profitable in its own right. And more recently, we've been leveraging the technology platform to develop superior products for diabetes care that we're taking forward into clinical development ourselves.
That's great. And do you have an example of one of your products to demonstrate?
Yeah, sure. So probably one that's easiest to explain is there's a condition that all people suffering from diabetes who are on insulin, so that's 25 million insulin users, are at risk of, called severe hypoglycemia. So essentially this is dangerously low blood sugar. It can happen very quickly and it's a life-threatening condition. So in this situation, the person's suffering from a severe hypoglycemic event and will quite quickly move into an unconscious state, heading towards a coma. So it's the requirement of another person, often a parent of a child, for example, to deliver this emergency medicine to them. Now, I have this product here now. So there are two emergency kits, so they come in boxes like this. They're both very similar on the market. And the challenge with these at the moment is that the actual glucagon product itself, because it's not stable as in liquid format, is in a vial of powder. And you basically have to mix these up under this emergency situation. So I'll show you how this is done, and bear in mind that the person themselves that requires glucagon is unconscious in a life-threatening condition. So what you have to do in this situation, you take the vial out, which has the glucagon in. You need to take the plastic cap off this, which reveals basically a rubber casing that you can put a syringe through. You then need to take the syringe, which you can see here has liquid inside, which needs to be mixed with the glucagon itself. You take this plastic cap off the needle. You then place this into the vial, and then you have to gently shake this until all of the glucagon is dissolved, so you have a clear liquid. And it's important to check that there's no bits within the product at this stage. You then need to withdraw the liquid, take the liquid back up into the syringe. So you do that by pulling the plunger back out. And at this stage, you'll have some air bubbles within the liquid itself, and it's important not to inject air bubbles into people. So you then press the plunger back down to remove all the air bubbles. And at this stage, you need to make sure at all of these points that the needle remains inside the vial. Once you've done this, again, you check that there's no bits within the liquid itself. And then the final step before you can inject it is to make sure you've got the right amount of glucagon to inject. So there's two lines on this syringe, one for adults and one for children under a certain age or a certain weight. So again, you press the plunger down to put some of the liquid back into the vial until the liquid gets to the right line on this syringe. At that stage, you're ready to inject. So you can pull it out and you need to inject it under the skin or into a muscle. And again, you imagine this is all being done in a highly stressful emergency situation. And as a result of this, there are a large number of administration and preparation errors associated with the use of glucagon. So only a low number of patients at high risk actually carry one of these kits because they don't believe it will be successfully administered. So what Arecor has been able to develop is something that's not been achieved to date, is a stable liquid glucagon. And what this will enable us to bring to the market is essentially a pen of glucagon that can be used in an emergency situation, that you simply press against the skin and press a button, and that will administer the dose to the patient, which will take a huge level of anxiety and uncertainty with the administration of that. And as I've said, the reason it's not been done to date is it's simply not been possible to develop this stable liquid, and we've managed to achieve this using our proprietary technology platform.
No, it sounds fantastic, I have to say. I can't imagine myself administering that to my child or myself in such a stressful situation. You've had quite a lot of success over the past year. You have been awarded a grant from Innovate UK. You've signed a big deal with one of the biggest pharma companies in India. What are your kind of challenges for the next couple of years, and what's your ultimate ambition as Arecor in many years on?
Yeah, I mean, for us, we've certainly got a very busy and exciting year ahead, and a number of strategic goals that we'll be aiming for. We'll continue to grow the technology licensing side of our business and the revenues and profitability within that. We'll certainly be bringing additional talent into the company. We already have highly talented and motivated scientists running the technology, and a high level of expertise across the management team to enable us to deliver our strategy, but we will bring more people into that. And on the back of some great data that we've generated over the last year on our diabetes products, we'll be working very hard to get those into the clinic and be dosing patients as quickly as possible. And we'll be looking to dose Arecor products in clinical studies in early 2018, which will be a huge milestone for us. And we'll also look to continue to grow our shareholder base. I mean, in terms of challenges, there's always risks associated with product development. But again, as I've said, we're taking existing products where the safety and effectiveness of these products is already known, and that's really the high-risk element of product development, and we're repurposing these to take them to the market. And the key here being that we're delivering product concepts that are simply not achievable and are meeting critical medical unmet needs, as you saw with glucagon.
Okay, and the ultimate long-term ambition, where are we going to see Arecor in the next 10 years, let's say?
Yeah, we'll be a significantly larger company than we are today, I'm sure of that. Our long-term ambition is to create a leading global specialty pharma company based here in the UK. We will be looking to continue to leverage our technology platform in developing superior products through this repurposing strategy, both with our partners and ultimately taking products to market ourselves. And clearly we have clear plans and vision in place for this, and upon delivering this we'd expect to return significant value to our shareholders as well.
No, that's great. You are part of our Elite program. You joined a year ago. Could you tell us a little bit more about where were you at that time as a company? What was kind of your reasons for joining? How did you find out about the program?
Yeah, I actually found out about the program at a London Stock Exchange IPO forum. I was there because obviously as a growth company we're looking at in the future, and an IPO being a potential route for continued growth for us, and I'd heard for the first time about the Elite program there. And really as a company we're at a place where the technology platform and the partnering side of the business was very successful and growing, and we'd literally just started developing products within diabetes care ourselves. So we were ambitious, we were growing, but we were on a solid platform there and a technology platform to take forward. So for us it was really looking at, we wanted to aggressively grow and make sure that we were fit for purpose, and with talking with the stock exchange in more detail about the Elite program, it seemed the right time to join that and really be involved in a forum that would bring together experts within the industry and peers of other CEOs and CFOs in similar positions with their companies.
And now a year on, how do you find it? What do you think is the biggest value add for you personally and for you as a company again?
Yeah, I mean, for me, the program's been really excellent. I think, you know, one of the key elements of it is it takes you out of your day-to-day job and forces you in a way to think more strategically about, okay, we know where we want to be 1, 2, 3, 5 years, and we know the organisation is fit for purpose now, but what do we need to be doing when to make sure we're still fit for purpose in 2 years, 3 years, 5 years? And really talking with those other CEOs around the challenges and opportunities that they've faced, because we're all at slightly different stages in the companies. So for me personally, that's been great, and I think for Arecor, certainly as a company, I go back from each session with a small short list of things that I'm going to do, perhaps initiatives I'm going to implement and into the company. So I think it's always obvious when I've come back from an Elite program.
No, that's great. Thanks, Sarah. It's very inspiring for us, I think. The last thing I would ask is, nowadays the industry is still, you know, kind of dominated by men, really. And you're one of you know, our female founders. You know, it would be really good to get your perspective on what you think are the things that we should be doing to make sure there's kind of, you know, more female founders, female entrepreneurs, female leaders, really. You know, and what are the things that helped you personally to be where you are nowadays?
Yeah, I think as a female CEO, and you're right that generally still it's fairly male dominated there. I think it's really partly to have confidence in yourself that you can do it, to not feel that you're compromising in some way if you have other commitments as well outside of work. I think you found certainly the females that I work with and the leaders across the industry is that can in many ways make you more effective and more efficient and not feel that you have to apologise for that. I think it's very achievable to be a CEO, female CEO of a company and hold everything else together at the same time. I think networks are important. I think it's important to see that, you know, it is feasible in both large and small companies to operate at a senior level, and for those of us that are at that level to help other people along the way as well. And I think forums such as Elite allows that, again, that network of individuals, both male and female, to connect and start to build that network again outside of the Elite program moving forward.
No, it's great. Thanks so much for coming. Thanks very much for the interview.